Everyone. This audio lecture is for visually impaired students on the topic drugs, chemicals in medicines and healthcare. The chemical substance used for treatment of disease and for reducing suffering from pain are called medicines or drugs. The term chemotherapy is used for the science in which the suitable chemicals are used for the treatment of diseases. These chemicals have specific effect for destroying the invading organism without injuring the cells of the body. In the practices of treatment of disease like Ayurvedic, the Unani system or the modern allopathic system, the drugs used are chemical compounds of the natural or synthetic origin. Let us discuss some specific classes of drugs used in allopathic system. Some of the medicinal compounds are discussed below. Antipyretics, the chemical substance which are used to lower the temperature of the body in high fever, are called antipyretics. Example: aspirin, acetyl salicylic acid, paracetamol and phenylacetin. Aspirin is prepared by acetylation of salicylic acid using a mixture of acetic anhydride and glacial acetic acid. Analgesic, the chemical substance which are used to relieve pains without causing impairment of consciousness, mental confusion, incoordination or paralysis or some other disturbances of nervous system are called analgesics. There are two types: narcotic non-addictive drugs, second narcotics drugs, non-narcotic drugs. The common non-addictive analgesics are aspirin and paracetamol. Aspirin, 2-acetoxybenzoic acid, is most familiar example. It inhibits the synthesis of compounds known as prostaglandins which stimulate inflammation. Example: these are the various types of tranquilizers which functions by different mechanisms. The most common one is non-adrenaline, which induces a feeling of well-being and helps in changing mood. It is one of the neurotransmitters that plays an important role in mood changes. If the level of noradrenaline is that play an important role in mood changes. If the level of noradrenaline is low due to certain reasons, then the signal sending activity of the hormone become low and that person suffers from depression. In such cases, the patient needs antidepressant drugs which inhibit the enzymes which catalyze the degradation of non-adrenaline. If the enzyme is inhibited, the metabolism of degradation of non-adrenaline. If the enzyme is inhibited, the metabolism of important neurotransmitter is slowed down and this can be activate its receptor for longer period of time and therefore counteract the effect of depression. The commonly used antidepressant drugs are iproin, azide and phenylgene. Some other most commonly used tranquilizers are barbituric acid and its derivatives such as vernal, amytal, memubutal, seconal and luminal. These derivatives are called barbiturates. They are hypnotic, i.e. sleep producing agent. In addition to barbiturates, a large number of other non-hypnotic tranquilizers are known. For example, chlorodiazepoxide and meprobamate are relatively mild tranquilizers suitable for relieving tension. Equanil, it is also an important tranquilizer used in depression and hypertension. Some other substances used as tranquilizers are Valium, Vernal, serotonin, etc. in the tissue and causes pain. These drugs are effective in relieving skeletal pain such as that of arthritis. Aspirin has also been very popular because it has antipyretics temperature lowering properties. Now, aspirin also find use in the prevention of heart attack because it has anti-blood clotting action. In addition, many other potential application of aspirin presently under investigation include pregnancy-related complication, viral inflammation in AIDS patient, Alzheimer's disease, dementia, cancer, etc. Because of shortcoming of aspirin, other analgesics like naproxen, ibuprofen, and diclofenac, sodium and potassiums find used as alternative. Narcotic drugs. Certain narcotics which produce sleep and unconsciousness are called narcotic drugs. For example, morphine and its derivative codeine, heroin, manjuria are used in severe pain as analgesics. These are known to be habit forming. When used in medicinal doses, these relieve pain and produce sleep. However, in excessive poisonous doses, these produce stupor, coma, convulsions, and ultimately leading to death. These narcotics are referred to as opiates because they are obtained from the opium poppy. The analgesics are mainly used for relief in post-operative pain, cardiac pain, and pains related to childbirth and terminal cancer. It may be noted that even now, aspirin is the drug of choice for the prevention of heart attacks and as a reliever of pain in angina. Tranquilizers. The chemical substance used for the treatment of stress, fatigue, mild, and several mental diseases are called tranquilizers. Tranquilizers are neurologically active drugs which affect the message transfer mechanism from nerve to receptor. These are used to relieve or reduce mental tension, irritability, excitement, and anxiety, leading to calmness. These form an essential component of sleeping pills. They act on higher centers of nervous system. These are also called psychotherapeutic drugs. These drugs makes the patient passive and helps to control their emotional distress or depression. These also help to restore confidence and the patient work with which they have already. Antiseptics. The chemical substance which are used to either kill or prevent growth of microorganisms are called antiseptics. These are not harmful to living tissues and can be safely applied on wounds, cuts, ulcer, diseased skin surface. These are also used to reduce odor resulting from bacterial decomposition of the body or in the mouth. They are therefore mixed with deodorants, face powders, and breath purifiers. We all must be familiar with antiseptic creams like furacin, sofromycin, etc. The common examples of antiseptic are Dettol. Dettol is an antiseptic. It has a mixture of chloroxanol and terpenol in a suitable solvent. Chlorogenol has both antiseptic and disinfectant properties. Bithenol. Bithenol is antiseptic which is generally added to medicated soaps to reduce odor produced by bacterial decomposition of organic matter on the skin. Iodine is a powerful antiseptic. It is used as a tincture of iodine which is 2 to 3% iodine solution of alcohol water. A dilute aqueous solution of boric acid is used as weak antiseptic for eyes. It also forms a part of antiseptic baby talcum powders. Iodoform is also used as an antiseptic powders for wounds. Hydrogen peroxide is also used as a mild antiseptic under the name perhydrol for washing wounds, teeth, ears, etc. Salol, salicylate is used as an intestinal antiseptic for throat ailments. Potassium permanganate, KMnO4, is used as antiseptic in dilute solution. Amyl metacarosol 5-methyl 2-pentyl-phenol is an antiseptic which is used commonly as mouthwash or gargles in infection of mouth and throat. Some organic dyes are also effective antiseptic. These are used for treatment of infectious disease. The common example of antiseptic dyes are xanthan violet and methylene blue. Disinfectant, the chemical substance which are used to kill microorganisms but they cannot applied on living tissues are called disinfectant. The same substance can act as disinfectant as well as an antiseptic depending upon its concentration. For example, 0.2% solution of phenol act as an antiseptic and its 1% solution act as disinfectant. Some other examples of disinfectant are Cl2 is used for drinking water fit at concentration 0.2 to 0.4 ppm. Low concentration of sulfur dioxide are used for sterilizing and prevention of squashage. A naturally occurring phenol derivative thymol is used as powerful disinfectant than phenol. A solution of kerosol in soapy water is called lysol and it is used as disinfectant for floors. Antimalarial. These chemical substances used for the treatment of malaria are called antimalarials. The alkaloids quinine has been used as an antimalarial for a long time. These days, a number of synthetic drugs have been prepared for the treatment of malaria. For example, chloroquine, paraquine, trimaquine, etc. Antimicrobials. These are the chemical substances used to cure infections due to microorganisms. The disease in the human beings and animals may be caused by a variety of microorganisms such as bacteria, viruses, fungi, etc. The microorganisms are extremely small organisms which can be seen only with a microscope. These are also called microbes. Any organisms which causes disease is called pathogen. However, body possesses an efficient natural defense mechanism which operates at all times against potential pathogenic microbes. The skin is impervious to microbes. Our many body secretions either kill the microbes or inhibit their growth. The common example of secretions are lysosomes, are lipid splitting enzymes, interiors, nasal secretions, saliva, fatty acids and lactic acid in sweet and sebaceous secretion and hydrochloric acid in stomach. The pathogens reach the tissue due to a breach in defense mechanisms and cause infection. Invasion and multiplication of an organism in infected host destroy the normal cell metabolism and cause psychological disturbance to the body, which appears in the form of some disorders or diseases. In addition, toxic substances produced by the microbes may adversely affect the tissue or organs of the host. The control of microbial disease can be achieved by the following three ways: by drug which kill the organism in the body, bactericidal; by drugs which inhibit or arrest the growth of body, bacteriostatic; by increasing immunity and resistance to the infection of the body. In early 20th century, the scientists tried to reach the chemicals that would adversely affect the invading bacteria but not the host. Paul Ehrlich A German bacteriologist investigated arsenic based upon structure in order to produce less toxic substance for the treatment of syphilis. He developed a medicine, arsphenamine, as the first effective treatment for syphilis. Erlich Pohl got Nobel Prize in Medicine in 1908 for his discovery. Although salvarasum is toxic to human beings, but its effect on bacteria spirochete, which causes syphilis, is much more than on the human being, and hence it could be used for the treatment. Thank you.